I'm Dr. Erica Bove, and welcome to the Love and Science podcast. I'm your host and also the founder of Love and Science, Thriving Through Infertility. I'm so excited you're here today. With over a decade of experience helping thousands of women just like you, I empower professional women to build their families with confidence and compassion. Let's dive in. Hello, my loves, and welcome back to the Love and Science podcast. I am so excited to have an amazing guest on this evening. We are recording in the evening. Her name is Dr. Chhaya Makhija. She is not only a colleague, but she's also a friend. She is a phenomenal human being. Her patients have tremendous outcomes, and she's just doing such amazing work in the world. So let me tell you a little bit about her and why I wanted to have her on this podcast. So she is triple boarded in internal medicine, endocrinology, and lifestyle medicine. And she uses all these ninja strengths in the practice that she founded herself called United Endocrine and Diabetes Care in California. She has not just one, but two practice locations, both in the Bay Area and Central California. And she also has academic affiliations as well, which I think is so amazing because she is super evidence-based. She also has a podcast called Hormones and Hope. I have been on her podcast before. We'll put the link to that episode in the show notes. And I think what's so cool about Dr. Makhija is that she really does blend science with lifestyle tools to optimize outcomes. I think we're going to get into it. So welcome, Dr. Makhija. It's so wonderful to have you here. Thank you for being on the podcast.
Thank you so much for the introduction. Thank you. You pronounced the name absolutely correctly. And, it's Unified Endocrine and Diabetes Care.
Yes, Unified, yes.
Completely fine. But there was a reason. I was trying to look for a terminology which synchronizes with complete or whole or integrative medicine, but I needed a different word. And that's where unified came about.
Unified, right? And it's like my doctor handwriting because I like to write everything myself. And I mean, but I think that's such a great name for your practice because you really do unify so many parts of medicine that are otherwise fragmented. And people are like, why am I not getting better? Why is my A1C not budging? Why is my thyroid stuck? Why don't I feel better? Right? Why am I stuck? And because of your expertise and your tools, you're able to help people budge the needle to finally make progress that they haven't in maybe decades, So I think a lot of my patients and clients feel stuck in their journeys. Maybe it's been a journey that's lasted, months to years. Many of my patients and clients have been on this journey for years. And so I'd love, us to talk about, how you approach holistic healthcare, right? Like you have this holistic medical practice where you talk about hormones. And just like Love and Science, right, we combine the emotional aspects and the scientific foundation. Like, how do you think, like, what made you form your own practice, and how do you approach a person in front of you who maybe feels stuck in their journey, in their healthcare journey?
Sure. That is a whole lot, but I'll unify your question because it's very close to my heart and dear and near to me. When we talk about holistic health, I think every one of us who's entering into medical school, that's what we aim for, or that's one of the purposes that we decided to become a physician, right? A healer. And we never thought of that, oh, I'll just be taking care of the heart or just the uterus or just the brain. It has to be everything. So that's one of my main reasons to pick internal medicine, that it's internal, right? And internal is also touching our soul, it's touching our mind, it's touching the body. And then comes the science, which is also about the environment and the body. And endocrinology, because that's the fun part of medicine, which doesn't have one organ system. It's from top to bottom. And there are so many chemicals, neurochemicals, or neuroendocrine conditions that cannot be just visible, or it's a lot of blood work that needs to be done. And it has these plethora of symptoms. And what I enjoy is the complexity of it and how can I simplify. So that becomes holistic, because simplification is not just talking to the patient or reviewing the labs or examining them, but it's digging deeper into that human being to get or solve the jigsaw puzzle and get the answers. So with that being, with that encompassing everything, endocrinology is a study of hormones. And we all know, at least now in this era, with women's health taking more of a forefront, and also people recognizing that why health is important, people recognizing that why are we stressed, and they're being more aware that we are stressed, right? And that is a lot to do with our hormones. Our hormones are these amazing messengers that crosstalk with every cell.
Mhm.
And when they're messengers, we really need to take care of these messengers, because what we feed in is also being translated as what's going to be outside. So it could be in the form of a disease, it could be form in the symptom, it could be in the form of an abnormal lab, and that leads to a set of diseases or conditions that's taking you to a physician, that's taking you to now seek medical care. So those are, reasons that I really love this profession, love this aspect of medicine. And now we combine that into clinical care. And I'll be happy to share more details if you'd like to, being more specific on these endocrine conditions.
Oh my goodness. I am so excited that you said it this way. I'm a reproductive endocrinologist, as you know, and I have never quite thought of hormones as messengers. I think
Mhm.
of a conversation, but I think about like, just as like thoughts and feelings are data, right? I think that each hormone truly has a story to tell,
Mhm.
right? Like if we think about
Absolutely.
it that way, the hormones might tell a story about the soul, right? And we need
They
the
would.
right listener, the right
Mhm.
interpretation to be able to decode what what is happening. And it might not even be like one clear signal. It might be a conversation that needs to be unpacked. But I think if we look at the hormones as messengers, that's when we can start to understand what's going on and listen, and then have the space to take action. That's so
Mhm.
beautiful. Yeah.
Yeah.
So
Good.
I'd love to get your perspective on stress. And I think we started to talk about that a little bit. Like, why are we so stressed all the time? When we have chronic medical conditions, infertility is one of them, and recurrent loss. Like what is it in our bodies internally that is going on that makes the physiology so altered?
Yes. So stress, I'll just say that I'm 45, and when I was in medical school, this was in India, we never talked about stress. We, if there were board exams, or if we had, an event, or you're standing up and speaking, or there was a debate going on, and there has to be public speaking, we never ever even thought, or the word never occurred to us that we are stressed. It's just that, oh, I have this, I'm nervous, or how am I going to perform? And you put in the work and you go, right? So there is a lot that we've learned over time, and we've recognized because of the advancement in science, and also the medicine or the clinical terminology is getting out in the public, right? Or being available to all of us. So stress, if you read medical textbooks, was first defined as a flight and fight response, right? A bear attacks you, you take protection, and you only need cortisol and adrenaline. Those are the main hormones which help you with fight and flight response. You don't
Mm.
need reproductive hormones. And similarly, reproductive hormones are not necessary for survival. I'm just talking about survival. When they're not necessary, what happens is when that bear attack is happening, our frontal brain is more active, as
Mhm.
well as the adrenaline and cortisol, because we need those two hormones to take action. Now, imagine in today's era, 21st century, we are up in the morning worried about how my day is going to go. I have meetings, I have deadlines, I need to drive, I'm commuting for 30 minutes. Let me just have my breakfast in the car. Oh, I don't have breakfast. Let me just grab some coffee. Oh, the Starbucks line is too long. What do I do? Right? So there is a lot of fight and flight response or events happening literally every minute. And that's not just for one day, it's happening consistently. And then when we are sitting with ourselves, right, what are we thinking? Are we more into that negative notion, worry, anxiety?
Mhm.
aspect of our lives, of the future, or, worrying about what happened in the past, versus are we still living in the present? We are more mindful of what we are doing, what we are eating, as well as taking care of ourselves, self-care.
Mhm.
Are we spending time in our relationships? Are we there to listen? Right? Not just express, but are we there to be available to our family, to our friends? So we've lost that time. So the chronic stress is consistent. And when we talk about chronic stress, it is cortisol and adrenaline, and it's not necessarily just the cortisol. So imagine if we are exposed to every minute of fight and flight response every day, ongoing for months and years. That is, I'm getting attacked by a bear literally every moment. Either it's
Right.
self-induced or it is through the environment. What is going to happen to my reproductive hormones?
Mhm. Mhm.
We all can answer that individually. And I'm not saying that they'll completely get suppressed, but there'll be alterations. There'll be more chaos. There'll be chances that, the ovulation gets affected rather than just the menstrual cycles. We have a very common terminology called female athlete triad. And that's a stressor because that female is not getting adequate calories.
Mhm.
Similarly, these daily events, if we are not appropriately learning how to respond, that is going to create a long-term changes in how our hypothalamic pituitary ovarian axis or hypothalamic pituitary and gonadal, that's testosterone axis, is responding.
Mhm. It's hard because it's hard to measure. It's very
Yes.
subtle, and I think we all know when we feel under stress. I mean, there's this concept of eustress that not enough stress is not good, too much stress is
Mhm.
bad. But I think most of my listeners are female physicians, and at the you know at very least, like female professionals, like everyone is like rocking it out in their careers, CEOs,
Yes.
attorneys, physicians, like many people have high powered jobs, which are stressful. And then throwing on top of that, the fertility journey, where there's this constant, like, am I giving myself the right meds today? Am I showing up at my
Mhm.
fertility clinic? I mean, a lot of these treatments are coming every other day.
Mhm.
Without sometimes even with only 24 hours of notice when the next appointment's going to be. And a lot of my patients and clients are like, living in regret. Like, did I make the right decisions in the past? Like that cycle didn't work out if I had only done XYZ, or also thinking about the future, like, well, what if this next transfer doesn't work and I only have two more embryos? And like, what if I have to do another retrieval? And I think this sort of bear analogy is so apropos because it's like, well, what if I cannot achieve my goal of being a mother? Like, I
Mhm.
hear this a lot, like, this is the last puzzle piece. I met the love of my life. I, have the career, all the things, like, this child, this potential child, but if it doesn't happen, I'm going to be missing this piece like forever. And I
Mhm.
think that threat of childlessness or that threat of not building the family, it feels so intense that it would be really interesting. We have all these monitors, right, that we wear, or rings and
Uh,
such. Like, it'd be super interesting to just understand the profile of those two hormones that you mentioned
mhm.
on the day to day, like moment to moment, because my sense is that people's, nervous systems, axis, this stress hormone axis is just very amped up all the time.
It is, yeah.
Yeah.
So in clinical world, I get a lot of referrals. Either it'll be curbside consults from physicians or actual referrals, patients seeing me for mild elevation in cortisol levels. And it's specifically done at 8 a.m. They're fasting and they're fairly having a decent sleep cycle. And usually the threshold is anything, depending on the lab, 20 or 22 micrograms per deciliter for cortisol, like the higher level. And most of them are running close to 30s.
Interesting.
And yes, and when I get to know about their life cycle, many of them are more of like a type A personality in that category, like the go, 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 but very high achievers. But there is this constant
Yeah.
worry or the constant thoughts which are lingering around through the day. And they're getting all the workup. They don't have Cushing's disease. They don't have Cushing syndrome. They're not overproducing cortisol pathologically. But I see this very commonly. So yes, if everyone starts getting these levels done, I wouldn't be surprised that many of us have this higher threshold. Now, what would be interesting is to look at, during the day and figure
Mhm.
out. But even if we don't have that tool right now, right, we have so much obvious evidence because endocrinology is also your symptom. Endocrinology is also knowing what's happening in your life. And there are
Hmm.
so many diagnoses that we could make with that clinical discussion. And then labs are more as an adjunct or support to rule out certain conditions that are, more grave or worrisome in terms of leading further to a specific diagnosis.
Yeah. So what's your approach to, I mean, this is fascinating to me because I don't see this in my practice. Sometimes, every now and again, I might rule out something, but I'm not seeing patients with known mildly elevated cortisol levels. So, how do you approach somebody like that to help them to feel better, to help them to restore physiology? Like, what do you do?
So that's where, collaborative approach comes around, right? So once we are aware or we've recognized it, right? And I'll tell you, like half of the patient population will recognize it or they will acknowledge that, yes.
Yeah.
The other half, it's still difficult for them to comprehend that, oh my gosh, am I just causing a problem and it's self-induced. So it's very difficult for them to get into a stage where it is more of like an acceptance. And then they can start working on it. So both of them
Uh,
need a very personalized approach in how we can address it. So say, for example, since we're talking about stress, we're talking about cortisol. Now, adrenaline is something that cannot be tested because it varies very quickly. And then, we have other parameters. So we don't check serum adrenaline level or epinephrine, norepinephrine level as such for daily basis. But cortisol, we do have a lot of evidence, clinical evidence. So, one thing is recognizing it, but also ruling out because the patient has probably come to you for some concerns or symptoms or an abnormal lab.
sure,
So I'm still going through this entire differential of are there any other reasons that those levels could be higher? Once
sure.
you know that it is related to how we are living our lives, right? The second thing is awareness. And then comes, okay, what can I do? So a good bunch of patient population, and this is both men and women, it depends on how they wind down the last 12 hours of their day. And this
Interesting.
also impacts, hyperglycemia, insulin resistance. So this is like a constant discussion, even with my patients who don't necessarily have a lab test showing high cortisol, but how they lead their lives, I can see that on their hyperglycemia. Um,
Hmm.
Monitoring or CGM monitoring during the nighttime, right? So our last 12 hours, how are you winding? Just like we are living,
Well, did you say 12? Did you
yes,
say
12 hours. I said 12
the
hours.
last 12 hours of our day?
Mhm.
That's a long
It
time.
is. I'm not saying we are, just ready to go to bed after 12 hours of work, but how are we winding down? Okay.
Okay.
So this is also dependent on your cortisol, your circadian rhythm. For men, testosterone, because it is following that circadian rhythm. Like if you check a 4 p.m. testosterone, we are actually checking for more of a nadir level or a low level, which is physiologic. And then if we have to look at the peak level, it's mostly in the early morning hours
In the
between
morning, yeah.
8 a.m. Similarly for cortisol, right? So naturally, physiologically, for that homeostasis, for that balance to occur, our cortisol tends to rise. So imagine 4 to 8 a.m., it's at its peak level, and then it stays in that higher zone, but it's not peak, but it's still at a higher level physiologically. And then it tries to get to a lower level. So by 4 p.m., 6 p.m., it's getting lower and lower. And then the lowest is, after midnight or 11 p.m.
Interesting.
For the graphs to explain. So that means like, how are we winding down, right? If the cortisol physiologically is having this, following the circadian rhythm, so, after 6 p.m., 7 p.m., so very commonly we talk about meals, right? When is your last meal? At least 2 to 3 hours before you go to bed. And then
Hmm.
what are you doing in those 3 hours, right? It could be a walk, it could be some time with your friends, it could be some time with your relationships, versus are you just spending all those 2, 3 hours with the screen time?
Right,
Right.
exactly.
And that's
Interesting.
very commonly seen, even sleep specialists, even, even primary care doctors really talk about these positive sleep habits or bedtime habits, to be very specific. So if we are up and about, my adrenaline is going to be high, right? I get excited watching something, or I'm worried about something, news channel, that creates some angst. And cortisol and adrenaline, they are going, simultaneously participating in that stress response, right? So we are not letting it wind down. Now, it doesn't mean that we're
Interesting.
going to get lethargic. It doesn't mean that you're going to be fatigued. It doesn't mean that you don't have to do anything and just sit and not and don't perform. That's not the point. But it depends on what activities I'm performing latter half of the day versus the early part of the day, right?
It's so interesting that you say this because I'm imagining, my patients and my clients going about their day, their cortisol levels are what they are, 4 to 8 a.m., right? And then they go to work. I think, work is somewhat of a distraction. Sometimes they pop off at the fertility clinic on their way into work. So they're rushing around, trying to make sure that they get their ultrasound, their blood work, they make it to work, right? Then they do their rounds or whatever they do for work. But then it's like, I almost like imagine these like blips throughout the day. They have that thought, okay, when's the nurse going to call about my estrogen level, right? And then that's the thought. And then it pipes down because they got a patient to focus on, right? So they keep plowing through. Work is sometimes a welcome distraction. And then it's like early afternoon, the nurse's call, maybe it's not good news. And it's like that other, stress again, right? And so then okay, got to power through the rest of the day, got to finish the patients, finish the notes, all that stuff. But then, they go home and some people have partners, some people don't. But then
Mhm,
there's like this open space where it's like,
mhm,
sometimes that's really when the thoughts and the feelings and the fears and the concerns and the anxieties that those start knocking very loud because now there's not the distraction of the workday to kind of drown that out. So I wonder what this sort of like data would look like in people, female physicians on the fertility journey, particularly undergoing this process of like, yes, there's like this baseline stress of like trying to be a doctor, trying to take care of the patients, but then throughout that is this superimposed, all the things that happen in the fertility journey, the appointments, the waiting, the calls. And sometimes like I can't tell you how many times, like even this week I coached with somebody who was like, I told the nurse not to call. I like sent the portal messages. I said, I'm in the middle. I don't
yeah.
want to get this news. And like, they just couldn't get the memo that this, and maybe their workflow is that, you just always call or whatever. They're trying to get through their day too. But it's like when you ask for a certain mode of communication that's not respected, then it adds even more stress, right? And you're
Mhm,
calling the pharmacy and trying to get your medicines, or maybe you got
mhm,
to get something clear with your insurance. Like it's just like this incessant, stressful, like
mhm.
part to full-time job in addition to what people are doing. So what do you think that profile looks like, and what do you think could help based on the tools that you have for your patients with these, sort of mild but bothersome elevations in stress? Like what do you think could help my people to just like have a more steady hormonal state throughout the day?
Yeah, yeah. So this is, very important to know that we are not discussing that stress is not normal. There is a
Mm-hmm.
way that we can make stress very positive, right? So we can perform better. There is a better output, or there's a better outcome in the future.
Sure.
And that's why it's good to get a little nervous before your exams. It's good to get nervous before you're going for a proposal. It's good before you're entering into a meeting where you have to present data. All right, because it's going to help you perform even better. So there's a fine
Mm-hmm.
line between that stress versus this chronic stress that you're talking about, where we are being exposed to it every day on a daily basis consistently, and that becomes a routine, right? And we think
Mm-hmm.
that this is norm for us. And if we have to live life, this is how it's going to be, the go, 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 right? So that
Yeah.
is what we are interested in breaking the cycle, because that is definitely going to help us on how we live our life now, how we perceive it. So one very important aspect, which is also, we have a lot of evidence regarding it, is breath work. So when we talked about awareness, yes, you're getting all your medical expertise, you're getting your evaluation so that you're not, missing out on any major pathologies. But when you realize that, okay, there is this contribution of stress response, which is more chronic for me, and how I can address it, One is definitely seeking support. So I'm so glad that physicians actually seek out the coaching aspect of it, which is very innovative and very much needed, because that may not happen every time in a patient-physician relationship, right? Because of the time and also access. So coaching, and we have coaching in different aspects of lives that we are, that we are in this journey, and we might have different fields that we need coaching for. So that one is definitely helpful, seeking if I feel that there is a need for therapists, and
Mm-hmm.
encouraging them that, maybe there's a relationship issue which is leading to your stressors, so let's address it. But the tools in our hand, I call it as like calm on the go, which is the breath work that, we were initially discussing. So in India, it's called as pranayama. That is
Mm-hmm.
your life, your breath is actually helping you to connect to your true self. You can call your true self as God or whatever you believe in, but your actual true self, and your soul, right? So whatever you are thinking about connecting to, and that could happen with breath work. Now, the science behind it is that when we breathe, so you're inhaling and exhaling every day without even noticing, right? It's unconsciously happening without we thinking that I'm making an effort to breathe in and breathe out. But now this becomes more conscious. So when I'm
Mm-hmm.
aware that I'm breathing, that's the first step. The second thing is, can I focus on longer exhalations, or when you're breathing out, can it be longer? So 1, 2, 3, 4 is your inhale. It could be the same amount of counts for exhale, longer, longer, longer. We use these techniques in the hospital. When someone has supraventricular tachycardia, we ask them to bear down. We do these
Right.
carotid massages. What are we doing? We are actually stimulating the parasympathetic nervous system, right? We are stimulating the longest nerve, the vagus nerve coming from the brain,
Mm-hmm.
which is the rest and digestive system, right? So that's calm on the go. So you don't have to think that you need to be in medicine to learn these techniques. But this is the science, this is the evidence that stimulating parasympathetic nervous system is actually going to calm you down, right? It's going
Mhm.
to,
We know this, right? Our heart rates go down. We all are
yes,
obsessed with our smartwatches and everything.
yes,
Our breath, our respirations. We have like vital sign data
yes,
that this parasympathetic response is sort of taking over. We not just feel better, but our physiology changes. Which my understanding as a reproductive
mhm,
endocrinologist, please correct me if I'm wrong, is that we have blood pressure
mhm,
changes in a favorable way. And it just feels better, right? So I
yeah,
think that, and I mean, my understanding too is that if we have elevated cortisol, that sometimes that even affects our longevity, right? Our
mhm,
telomeres and all these, like,
mhm,
it's not just like, oh, I feel stressed. It's like, oh, this actually has, negative health consequences throughout the life. And so our
mhm.
breath it's always accessible to us. It's always there. We forget about it. And so how long would somebody need to do these techniques? Like, and it just say I'm like, maybe my next patient's getting roomed and like how we go in our sort of our days are very busy. Like what do you need? What's the minimum that you need to see like a meaningful change?
Sure. So that's not studied, that number of times you do it, but the consistency, right? So it's
Hmm.
like building your muscle for this. So awareness, when we talked about it, where am I getting more angst, right? Where am I just getting more irritated, right? Or where is my threshold of frustration like so low that anyone commenting anything, I can get irritated and frustrated. So recognizing those scenarios, right?
Sure.
First thing is in the morning, right? When we talk about gratitude, when we talk about, the every day is like your first day of your life, right? And how it's my choice how I want to live it, at least based on what I think. Right? What's going to happen?
Hmm.
Many of us don't know. There's uncertainty, but that's a very good time where we can actually be, accountable to ground ourselves. So
Hmm.
even if it's for a minute, even if it's for 30 seconds, the next time is, in the shower, because that's our
Hmm.
own time. So rather than having, 10 different plans occurring or creative ideas that are sprouting when we take a shower, good time to just get back into focus. The third one is for my men, which have like long commutes. I always talk to them about because they think that they don't have time, but in the car. They
Right.
always do. So I'm not being very biased, but yes, women and men. But usually male patients love this time where they're by themselves and they can really focus on breathing while you're actually driving, right?
Mm-hmm.
And then the next time it comes, like any room that you're entering in where you feel like, you know what, I don't know how this patient is going to respond. I don't know how many symptoms they'll be talking about, or
Mm-hmm.
I have to share this abnormal result. Take
Mm-hmm.
those 2 breaths, right?
Yeah.
But unless and until we don't practice, the last minute, it's not that it's going to just be a remedy and it's going to treat it. But the more we get in tune with it, now we're becoming conscious. So from
Right. And I'm thinking
unconscious
like as
become,
we're in the waiting room being called for at the
yeah.
fertility office, that's a great time to access the breath. As if we're, on the exam table waiting for an embryo
Mhm.
transfer, that's a great time to access the breath
Yeah.
because, thinking about sort of that fight or flight response, I
Mhm.
would love to see a study looking at uterine receptivity, because I
Yes.
truly think that people who are able to connect their mind and body, and again, if it doesn't work, it doesn't mean that people didn't do this well enough. I want to be clear about that. But I think as many things that can be aligned physiologically to be helpful,
Hmm.
when people can have that mind body connection and have that sort of full body relaxation, that's when I think that people can be most receptive at the cellular level to an embryo, right? And so I would like to bottle it up, but in the absence of being able to do that, I think that thinking about some of your breathwork strategies, we drop from the head to the body, we become embodied, right? We are one with the breath. And then, not just that, not just are we grounded in the moment, which is super important, but then we have these physiological changes related to parasympathetic tone that just
Hmm.
have like a world of benefit. So I think that is
Hmm.
amazing, amazing advice and suggestions on your part. And I would love to, I always have whenever I do guided meditations with my patients, we always, breathe in to get there and then we breathe out. But I think it costs nothing, right? It's like
Hmm.
nobody's trying to sell you this for thousands of dollars. Like it just truly, it's always accessible to us and it can make such a difference.
Oh,
Yeah.
absolutely, absolutely. And yes, you're right. We wish we had studies, but I look at so much of continuous glucose monitor data. Uh,
Oh, yes. Let's talk about that,
insane,
please.
insane amount of blood pressure logs that I have patients give me because they're first interested in lifestyle interventions, right, before they opt for medications. Um, and blood pressure, especially in that perimenopause, menopausal age group, and then in the postpartum period, it's been great, amazing. I'm talking about one aspect of lifestyle intervention, that's breath work, but there are other aspects too that we work on. In my office, I'm collecting data in my office every time if I see a patient, and that's the first time, like a new patient, their blood pressure, I have them practice. Like I'm going to check your blood pressure at the end of the visit, not at the beginning of the visit, because you don't know who are you going to meet, what's going the
Mm,
conversation be like, how is this doctor like? So their blood pressure is usually 10 to 15 millimeters of mercury lower in systolic. That's systolic blood pressure, not the diastolic. And this I have, I've collected plenty of data. So you already talked about blood pressure. Continuous glucose monitor, when they're practicing it, and the rest and relax phase, I usually start seeing the steadiness. And this is mostly during the nighttime. So between 12 a.m. to 6 a.m., where if they start changing their habits just before bedtime, couple of hours, suddenly their threshold from here, plateau, is going lower, right?
really?
Yeah, so once I collect more data, I could actually give you, more milligrams per deciliter changes. But I don't need to increase their insulin anymore, right? If they're on basal insulin, I just give them these tips, you practice, and then look at it again in a week, and
Oh,
you
that's
see
so
that change.
interesting. That's fascinating.
Yes, and similarly after eating. So 2 hours after eating, other than walks, engaging in these exercises like breath work, even if it's for 5, 10 minutes, especially post dinner. Oh my gosh, I usually will see 10 to 25 milligrams per deciliter change that they're having the same meal, by the way. And you're right that these tools, if we have more of these available to look at other hormones, they actually bring about more awareness. And now you're
Hmm.
empowering your patients, your people, that yes, now what's happening internally, you can see it and you make sure that you can correct it.
It's so fascinating. It's like just the body works better when we're not
Yes.
stressed, and we need to learn how to access the tools to become less stressed to be able to get to that better physiological state.
Hmm.
Now, Dr. Makhija, there are some fertility specialists who are actually having their fertility patients wear continuous glucose monitors. And, I have this huge patient population in Vermont where there's like either borderline glucose intolerance or, maybe even like, prediabetes even. And obviously if they have type 2 diabetes, we work to reverse that before doing anything as best we can. But like, what do you think about the role of, insulin resistance, hyperglycemia as it pertains to the fertility journey, and what do you think about CGMs as we think about like trying to help people with this part of their journey?
So break it down, right? So insulin resistance, pre-diabetes, diabetes. So I'll tell you my clinical experience that yes,
Sure.
GM, it's approved for type 2 diabetes, type 1 diabetes, and for gestational diabetes, and still not approved, FDA approved for pre-diabetes, but I use it. Patients are willing to use these tools, and if they know the nuances, which we learn together, right? They're able to like actually adapt to new changes, new lifestyle habits, but with
Mm,
their own choices, not that just because a physician recommended that to them. So with insulin resistance or pre-diabetes, it does affect. It depends on what the stage of that particular condition is, right? So if someone has pre-diabetes, that's A1C between that 5.7 to 6.4%, I actually encourage use of continuous glucose monitor, even though they're not FDA approved, so that even before they plan conception, within a month, I usually have few weeks that they're able to bring their average blood glucose down because then now they learn that, oh, my overnight blood sugars are higher than what happens during the daytime. Or, just extra post-meal walks have been helping me to bring my spikes lower, right? Or I
interesting.
realize that, this food is not for me because every time I eat this, I have these 2, 3 hour long phases of hyperglycemia. So I highly encourage, we have CGM devices which are over the counter, right? So that you don't
Really?
need a
Because that was going to be
prescription.
my next question is like, say
Yeah.
somebody's not lucky enough to live in California where they can see you as their doctor. Like, how does somebody like say in Vermont or New
Yeah.
York or like anywhere else in the world who doesn't have access to you, like, how do people do this? Like, what does it look like? You
Sure.
can buy them at the pharmacy?
So
Truly? Can
yes,
people do this?
so
Okay,
either, if you have one healthcare professional, it doesn't have to be whoever can prescribe, right?
sure.
Definitely ask that I just need a prescription for a continuous glucose monitor. Right now, we just have two brands, that's Dexcom and Freestyle.
Hmm.
And you have a right to ask them, and they have a right to give you a prescription. And say your health insurance doesn't cover it because you don't have type 2 diabetes or you're not on insulin, that's okay. Just use GoodRx, use Cost
Yeah,
Plus Drugs Pharmacy and use the coupons to buy it. And they're pretty reasonable in price. And I suggest at least use it like two sensors or a month worth. So now you learn your patterns, you learn what the nuances are. And I have a lot of resources, so they can always go on the YouTube channel. I always add on to like how to interpret CGM data. But if your primary care physician or if your healthcare professional is not interested in looking at the data, no problem. At least ask them for a prescription. Now,
right.
still in the United States of America, we have both Dexcom and Freestyle. They have over-the-counter sensors, and you can just go to their website and order some for you. You don't need a prescription. And they are also very reliable in terms of assessing patterns, not in terms of accuracy, but that's what you're looking for. You're looking for patterns. What's happening daytime? What's happening when I'm excessively stressed? What's happening when I don't sleep for a longer period?
Yeah.
And the
What do
food
you think?
relationship.
Sorry, yeah, the food, like
Ah,
the food relationships. What do you think about somebody who doesn't have a diagnosis of, prediabetes, but they're excessively stressed and they want to understand their patterns? Like, I'm just wondering, like, if there might be a role for some body awareness, some stress reduction techniques, and just like understanding the patterns of the
yeah,
physiology. Again, not in a way that like makes people obsessive about this, or it's not like
yeah,
one more thing, but in a way that really does. Oh, when I do breath work, like my blood sugar does this, even if I eat the same thing. Like I'm just imagining, I'm so getting so excited to think about this actually, because I'm just imagining all the potential benefits for
mm-hmm,
somebody whose stress response is sort of changing their glucose levels, and that they could do something about this with
yeah.
some of these techniques that you're saying.
Yeah, you're so right. So I have this whole plethora of patients who don't have an abnormal A1C, even myself, my medical students. So I have them wear it so that they can
Cool.
actually learn about, themselves, because unless you don't
Yeah.
know, something that you can experiment with, and then it's easier, simpler to explain it to your patients. So it's not that I encourage you to use it to know what your body's saying, but don't use it without having the knowledge. Knowing that it's a sensor glucose, it's not a blood glucose, it's not 100% accurate, and it's
Sure.
a delayed glucose level that we are getting. So always think about that. Can I gather patterns? So when you're using it for 14 days at a time, now you can understand when you go back, reflect on it. The second thing to be aware of is that every spike is not abnormal. So please don't stop
Mhm.
eating fruits because fruits are going to spike. So it doesn't mean that you have high blood glucose, which is
Mhm.
pathological, or you're pre-diabetes or diabetes. That being said, it's a great way to use it if you're trying to understand how is my sleep, how is my stress, how is my physical activity impacting my glucose level. And that could be a subtle reflection of your stress or the cortisol that you were talking about. And in those scenarios, just jot down all the notes. So all these sensor apps, they have a note section. So it's good to free text it so that now when you go back 7 days, in the retrospective zone of analysis or
Sure.
analyzing the data, that's when you can make a lot of conclusions that, oh, these are the days that I was restless. These are the days that I was worried about something, and you'll see more variations in the blood glucose.
That's super interesting. So this is amazing because I think it's going to help a lot of people. Are there any other lifestyle medicine tools that you think, might that people just might not know about in terms of like, stress reduction or navigating this process, overall health outcomes?
We all are aware of nutrition, so I won't talk about that. Physical activity, yes, right. I would also want to encourage, because you have, your female physicians, women physicians, that don't just think weight is the
Mhm.
only parameter for your health. We are moving further away from it. And I feel like many of them are really by a lot of worry, anxiety, concerns, doubts about themselves, and sometimes even shame with the weight on the scale. And be it, the
Mhm.
reproductive age group, or we have our females, women in the perimenopause, menopause age group. So in those scenarios, right, with the lifestyle interventions, we're not talking about medications here, your nutrition, your physical activity, we talked about stress management, your sleep. The quality of sleep is going to be very essential rather than thinking that I need 6 to 8 hours of sleep. And seeking that care is going to be very essential when you're discussing with your healthcare professional. And we talked about the breath work, right? But one important thing that I discuss with every patient, and they actually report back to me, so there is accountability, is journaling.
Oh, interesting. I love to journal. Yeah.
Because what I do is our patients, when they are journaling, and I ask them, just copy your journal and send it to me via patient portal. Because I
Cool.
show you that you've progressed, because we always forget that we've come a long way through. So you need someone else to remind you, even though they are your notes. So when like in our common coaching program, we learn about celebrating our wins.
Yes.
In patient care, I encourage journaling a whole lot. It could be 30 seconds, it could be 1 minute, it could be just talking to Siri and jotting it down, but sharing it with me. The reason I say share it with me, because now there is accountability. And
Sure.
I again reshare their own wins, their own progress when I see them in person. And they're like, oh, I
Mhm.
did not realize that I've come this way this at this place, and it was in such a short duration, and they are marveled by their own journey.
That's amazing. And I will say we do a version of that at Love and Science too, is we look at the progress, we look at the overall picture. Sometimes it feels like 3 steps forward and 2 steps back, but I say we are always moving forward. We're never moving backwards. We're always moving forward. And I think to have a guide like you or me, somebody who can objectively say, look at the progress, look at the growth, this is amazing.
Mm-hmm.
Like that's the whole point. It's not just like, is this one piece of data better? Is this, but it's like, how do we feel as human beings and are we evolving? And I always tell my clients, like, you never asked for this fertility journey, although it is yours. And so,
Mm-hmm.
like, how are we going to navigate it in a way that it's happening for us, not against us? Because it's a chapter, it's not going to last forever. But I
Mm-hmm.
do think that we can sort of lean in and say, okay, I'm going to make the best of this, and I'm going to make some friends, and I'm going to grow and learn how to set boundaries, like whatever it is,
Mm-hmm.
to be able to move on. So I think that's so beautiful. Um,
Well,
Gosh,
I'm
I'm
so
just so
glad you're
inspired by
doing the
you. I'm
same
so
exact things, you know. It's
yeah,
it's just different worlds or different fields, but
yeah.
still the same concepts.
And I think I remember now that, like, when I was a guest on your podcast, I remember thinking like how many similarities we have into, because I think we both have a tremendous interest in people achieving their highest potential, right? So
Mm-hmm.
many times people feel stuck because of lack of knowledge or lack of agency or whatever it is, but we have all the tools we need within us. We just need a guide and
Mm-hmm.
some confidence and some accountability. And I think those are the key elements to kind of bring it to fruition.
Mm-hmm.
So that's so beautiful. So, is there anything else that you'd like our listeners to know in terms of your approach to medicine, evidence-based pearls that you've learned over the years? I mean, we could even get into thyroid, but I think maybe, if we want to talk about that, maybe a different episode, like just in terms of just your experience and working with people over time and like really keeping the whole person in the
Mm-hmm.
purview.
Mm-hmm. Wow, that's a very I feel it's already an enlightening question. So
Uh,
the answer is more nuanced, but here is, what I can speak from my heart about this, right? One is I always talk about awareness, because unless and until we don't listen to our bodies, it's going to be
mhm.
very difficult to express what's happening, right? It's going to be very difficult to figure out who do I seek care from. So that awareness, and that's why we need some time with ourselves to not necessarily, you're not trying to find yourself yet, but at least recognize that I'm going through this pain or this symptom or this condition and I need answers. The
Mhm.
second thing is, yes, we have the internet, we have the Google search, now we have ChatGPT or different AI platforms, but still, hormonal world is very complex. And I'm not saying to scare anyone, but it's very complex. Symptoms versus labs could be very different in terms of what
Yes.
going through. So definitely seek expertise. And if you don't find an answer, don't hesitate for a second or a third opinion,
Yes.
because if you're suffering, sometimes it takes a couple of doors, extra doors that you need to knock before you get into the right room, right?
Yes.
So that's very, very important. The third thing is, you gotta trust. Right. So if you are aware about what you're doing, how you're doing it, and then you're seeking the care, the trust within yourself, and the trust that you've given to your healthcare professional or someone that who's going to guide you or your coach, that's very important, because if we don't have the trust, it's difficult to believe the transformation, right? It's
True.
it's difficult to get into that path of transformation. So, the medical expertise gets very important. Yes, we talked about, lifestyle medicine or how lifestyle strategies can be very beneficial. But trust me, we cannot ignore the science of the body. We cannot ignore, your evaluation, your medical testing, and that has to be interpreted appropriately so you can find the best care. So
That's
I would
so
combine all
true.
these rather than thinking that, every condition, every symptom is going to be resolved with, say, non-pharmacological methods. So always unifying both those aspects, but it starts with my awareness and then seeking that care.
And then trusting, right?
Trust.
And that's that
Yes.
surrender of like,
Yes.
I'm gonna trust this transformation to happen. And
Mhm.
That's just so beautiful. So, gosh, this has been so inspiring. Thank you for opening my eyes to things that I didn't know about previously, and also giving our listeners some tools that they can take with them actionably to not just feel better, but to help them move through their fertility journey with more ease and more confidence and with better outcomes. That's the point. So, where can people find you if they're in California and they want to work with you? Or near there and want to drive to you, like how can people find you, my friend?
Oh, thank you, Dr. Bo. This was very fun. Like
Yeah,
it was like one of the topics that I really, that's really close to my heart. So thank you for asking these questions and giving me this platform. I'm in California, so my website is unifiedendocrinecare.com, and you can reach me through there. All the links are there for the phone calls, but I'm also on Instagram, on YouTube. Dr. Bo talked about the podcast. It's
Mhm.
Hormones and Hope, and at Chhaya Makhija MD, just my name and MD, is where I am on social media. So I'll be happy to help you, or you can always add comments or messages in these platforms if there is more of a generalized question.
Beautiful. Well, thank you again for coming on to the podcast, and I cannot wait to continue collaborating with you. If I was in California, I would see you in a hot second because and I cannot wait until the next time I can actually see you in person again. It's going to be so
Yeah, you
wonderful.
wish that you don't have any endocrine disease or symptoms so that you can take care of your clients and, because you're helping them to live their life
Exactly.
with that highest potential. Yes.
Exactly.
Yeah,
Okay,
such
my
a
friends.
pleasure.
Until the next time.
Yeah, thank you.
Thank you so much.
Thank you for listening to the Love and Science podcast. I'm so glad you joined us today. If you found this conversation valuable, if you could please rate, review, and share this podcast with your trusted people, it would mean so much to me. If you want more tools to help you navigate the fertility journey, please book a discovery call with me today. The link is in the show notes. Please do not let infertility have the final word. I'm here to take the burden from you so that you can achieve your goal of building your family. In gratitude, this is Dr. Erica Bove. I'm rooting for you always.